Hello, good evening, friends. Today, let me tell you something about alarming symptoms when headache occurs. Headache, if it occurs in certain circumstances, which I am going to quote now, can be really alarming. It can be highly significant. One has to be doubly cautious when this sort of a headache is being seen in your patients. What are these headaches? 1. Sudden onset, first time headache. There are some people who can come and tell you, Dr. Saab, I have had the worst headache ever. When they say the worst headache ever, you must be doubly cautious about this. Late onset new headache. Headache occurring for the first time during late onset age, say beyond 50 years of age, say during advancing age, say during senescence. Be very, very careful about such type of headache. There are certain headaches. They are accompanied by what? Accompanied by fever, by rash, and stiff neck. Stiff neck, I need not elaborate further. As family physicians, you must have encountered a good number of cases wherein headache, vomiting, fever, stiff neck. What do you look for? Look for two signs. One is kulkarnii sign, other is bloodiness sign. What diagnostic formulation do you arrive at? Tuberculous meningitis. Progressively increasing headache. Be doubly cautious about this. Progressively increasing headache. Headache with neurological signs and symptoms other than aura. No aura is there. Only neurological symptoms and signs with severe headache. Be cautious about this. Headache with mental changes. Mental changes can be in different parameters, my friends. It can be in thinking, in emotion, in behavior, in perception. They can have delusions. They can have hallucinations. Headache accompanied by mental changes can be a very significant factor. It can raise the suspicion of a SOL in the brain or a bleed in the brain. Be cautious about such headaches. Headache with papilledema. I need not elaborate further. New onset headache in what type of patients? Two types of patients. New onset headache, number 1, in cancer patients. Number 2, in patients with HIV. If a person has been treated for cancer and he has been absolutely fine about 2 years post-cancer treatment, and now after 2 years he starts complaining of severe headache, suspect what? Secondaries in the brain. So these are some of the causative factors about which one has to be very, very careful. One has to be very, very vigilant. 1. Sudden onset first headache. 2. Worst headache ever. 3. Late onset new headache. 4. Headache with fever, rash and neck stiffness. 5. Progressively increasing headache. And 6. Headache with neurological signs and symptoms other than aura. 7. Headache with mental changes. 8. Headache with papilledema. Number 9 and the last, new onset headache in a patient with either cancer or HIV. Have you heard about something what is called as analgesic rebound headache? Thanks to our inappropriate bogus policies of the government, any Tom, Dick and Harry can go to an OTC counter and purchase medications. For headaches, they go to chemists and purchase what? Analgesics. Analgesics containing caffeine. Such patients consume about 8 to 10 tablets of analgesics per day. And in such tablets, each tablet may contain, mark my words, my friends, an amount of 60 milligrams of caffeine per tablet. They swallow about 8 to 10 such tablets in a day. These tablets containing analgesics, barbiturates and caffeine, they cause what is called as rebound headache. This syndrome is called as analgesic rebound headache. Treatment is what? Very simple. Detoxify such patients from these analgesics and their headache is cured. There is something about headache and in which conditions one has to be doubly cautious. Thanks a lot for watching. Bye-bye. Good night.